When I was in high school, maybe, there was a Snickers commercial on TV. And as I recall it, a high school or college quarterback got tackled and hit his head. And the trainers come up and they ask him some questions. And he gets most of it right. And then he kind of looks around and he says something along the lines of, "I am Batman," and clearly confused. And so they sit him on the bench and the commercial says, "Not going anywhere for a while, grab a Snickers." And so that was one of my very first exposures to head injury and its evaluation. And I'm not sure a commercial like that would really fly in today's environment because we are much more sensitive to the seriousness of head injury and more sensitive to how significant the injury can be. In the Journal of the American Medical Association, recently published an article that stated that there's about 2 million ER visits in the United States per year because of head trauma. That's probably only represents a part of how many patients actually hit their head. And then there are 220,000 hospitalizations and 64,000 deaths per year from head trauma. So head trauma can affect all of us. I think we all have family members, or maybe we ourselves have hit our head at some point. And then in neurosurgery, one of our primary jobs is to field phone calls and answer questions from the emergency room and make decisions about the initial triage and evaluation and then management of patients with head trauma. As opposed to the Snickers commercial, we are a little bit more sophisticated in our evaluation of head trauma. And there's two main ways that we do our triage. The first is through the physical exam. And there's a calculation that can be made called the Glasgow Coma score, which takes into account a patient's eye response, a normal being they open their eyes like I have my eyes open now, and a 1 on the score would be that they don't open their eyes at all. The second thing that we look at is their verbal response. Are they oriented? Can they have a conversation with you? Do they know where they are? Versus they're not talking at all, or they're confused, combative, and everything in between. And then finally, what is their motor score? Do they follow commands? If you ask them to do something, can they do it? Are they moving everything versus some sort of posturing motion or no movement at all? So you may see somebody or be involved with somebody that has a head trauma, and you may start looking at some of these things. Do they open their eyes? Can they talk to you? Are they oriented? Are they moving their extremities? And I think if anything's abnormal, and especially if there was a significant mechanism, such as a car accident or a fall, taking them to the emergency room for evaluation is appropriate. The second thing that we look at is what's on the head CT. The head CT is so helpful. It's a very fast study. We can see fractures of the bone. We can see bruising on the brain, different kinds of hematomas. We can see if there's swelling. We can see if there's shift. It takes about 30 seconds to get a head CT. And the combination of the physical exam and the head CT is how we decide how to triage a patient that presents to the emergency room with head trauma.